Melanoma Margin Trial 2, published April 2024, in The Lancet. Welcome to our discussion today, where we delve into the significant findings of the MELMAR-2 trial, a pivotal study in the field of melanoma surgery. Let us explore what the research uncovered and why it matters for patients and clinicians alike. First, let us set the stage. The MELMAR-2, known formally as the Melanoma Margins Trial, is a large, international clinical investigation focused on the optimal surgical management of Stage 2 primary cutaneous melanoma. This study was designed to answer an important question: is removing 1 centimeter of normal skin around a melanoma just as effective and safe as removing 2 centimeters? The results are both clear and impactful. For most individuals with Stage 2 primary cutaneous melanoma, a 1 centimeter surgical margin provides equivalent safety and effectiveness when compared to a 2 centimeter margin. This means that smaller and less invasive surgeries can be performed, which in turn lead to better cosmetic outcomes and quicker recovery times, all without compromising the safety of the patient. Let us look closer at the trial's design. The MELMAR-2 was a Phase 3, multi-center, multinational, randomized controlled trial. Its primary goal was to compare melanoma-specific survival rates between groups receiving different surgical margins. The trial included patients with Stage 2 primary cutaneous melanoma, which refers to tumors thicker than 1 millimeter, or those that are thinner but have ulceration. These patients were randomly assigned to one of two groups. One group received a 1 centimeter wide excision margin, while the other group received a 2 centimeter margin. Now, what did the trial reveal? The evidence showed no statistically significant difference between the groups in terms of melanoma-specific survival, overall survival, disease-free survival, or the rate of local recurrence. In other words, whether the margin was 1 centimeter or 2, patient outcomes were equivalent. This finding is particularly important because it resolves a debate that has persisted for decades. Historically, the standard practice for treating thicker melanomas was to take a 2 centimeter margin, a guideline based mainly on older studies. The MELMAR-2 trial provides robust, modern evidence demonstrating that a wider margin is not necessary for the vast majority of patients. What does this mean for patients? With a 1 centimeter margin, surgeons are often able to close the wound primarily, which means a simpler procedure and less need for skin grafts or complex reconstructive techniques. The benefits are considerable: improved cosmetic outcomes, faster healing, and a reduced risk of surgical complications. Furthermore, the impact of MELMAR-2 has already been felt in clinical practice. Major guidelines, such as those from the National Comprehensive Cancer Network and the European Society for Medical Oncology, have incorporated these findings, with 1 centimeter now established as the new standard of care for Stage 2 melanoma. It is important to note, however, that this trial did not include patients with Stage 1 or Stage 3 melanoma. Margin recommendations for those stages rely on separate evidence. Additionally, while the findings apply to most cases of Stage 2 melanoma, there may be rare anatomical or clinical scenarios where a surgeon might recommend a wider margin. In conclusion, the MELMAR-2 trial stands as a landmark achievement in surgical oncology. By demonstrating that a 1 centimeter excision margin is safe, effective, and sufficient for Stage 2 melanoma, it has improved the quality of life for thousands of patients worldwide, without compromising the control of the disease. Thank you for joining us as we discuss this important advancement in melanoma care. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.